Assalamu alaikum. My name is Rahaf Nadir. I'm a third year medical student at Ahfad University and I'll be your doctor for today. Can you please tell me your full name and age?
Basma Mahmoud, 20 years old.
Okay, Basma. Today I'll assess your upper limb. This involves me to ask you to walk as well as for me to look, touch, and move different parts of your upper limb. Is that okay with you?
Yes.
Thank you. I've washed my hands and asked the patient to expose herself until the umbilicus. I must be sure that there is good privacy, warm room temperature, good source of light, and a firm couch, as well as all my equipments are here, which are a hammer, a pin, a cotton, and a tuning fork. Can you please take a few steps towards me? And back. Can you place one foot in front of the other? On your heels? On your tiptoes? Thank you. General inspection, normal gait, normal speech, normal facial expression, no abnormal movements, and no apparent deformity. Can you describe your mood?
Good mood.
Assessing the patient's mental status, the patient is neatly dressed, well-behaved, in a good mood, and conscious. But I'm going to assess the level of consciousness using the Glasgow Coma scale. Okay, can you tell me what time is it?
Approximately 4:20.
Where are we?
University TR5.
Who's this person?
My friend Drew.
Okay, now I'm going to give you a few numbers and I'm going to ask you about them later.
Okay.
2, 5, 1, 1.
Okay.
Okay, what did you eat this morning?
Cheese croissant.
Where did you go to primary school?
Al-Qabis School for Girls.
Can you multiply 8 by 8?
64.
Okay, what was the number I told you about earlier?
2511.
Thank you.
You're welcome.
Assessing the patient's higher function, the patient is oriented about time, place, and person, as well as all types of memory are intact and is in good intelligence according to her level of education. Now I'm going to do the vital signs, which are the blood pressure, the respiratory rate, the pulse rate, and the temperature. On general inspection, both shoulders are symmetrical, no surgical scars, no abnormal movement, no apparent deformity, and no muscle wasting. Now we're going to assess the pronator drift. Can you please outstretch your arms and separate your fingers? Can you flip them? Now close your eyes. Can you flip them? Flip them back. You can open your eyes. Thank you. No pronator drift. Now we're going to assess the tone. Can you please relax your arm and give me your hand?
Yes.
Flexion, extension, abduction, adduction of the shoulder joint. Flexion, extension, abduction, adduction of the shoulder joint. Flexion, extension of the elbow joint. Flexion, extension of the elbow joint. Flexion, extension of the wrist joint. Flexion, extension of the wrist joint. Now we're going to do the cogwheel rigidity. Normal tone. Now we're going to assess the power. Can you do like this?
Yes.
Resist me. This is flexion against resistance of the shoulder joint. Resist me. This is extension against resistance of the shoulder joint. Can you do like this? Resist me. This is abduction against resistance. Resist me. Adduction against resistance. Can you do like this? Resist me. This is flexion of the elbow joint against resistance. Resist me. Resist me. Extension of the elbow against resistance. Thank you. Can you do like this?
Yes.
Resist me.
Okay.
This is extension against resistance, flexion against resistance. Resist me. Extension against resistance, flexion against resistance. Can you do like this?
Yes.
This is flexion of the fingers against resistance. Now we're going to abduct and adduct the fingers. Resist me. Can you do like this? Resist me. Thank you. Normal power, grade 5. Now we're going to assess the muscle reflexes using a hammer. Can you please relax your arm and give me your hand?
Yes.
First, identify the biceps tendon by slightly flexing the elbow. Observe the biceps contraction. Identify the triceps tendon and observe the triceps contraction. The brachioradialis and observe the muscle contraction. Thank you. We're going to do the other side. Can you please relax your arm and give me your hand?
Sure.
Identify the biceps tendon by slightly flexing the elbow. Observe the muscle contraction. Identify the triceps tendon and observe the muscle contraction. The brachioradialis and observe the muscle contraction. Thank you. For examining the abdominal reflexes using the tip of the hammer, the patient must lie supine. We're going to divide the abdomen into 4 quadrants, starting from the umbilicus and moving to each quadrant. First, identify the umbilicus. Start from the umbilicus and move to each quadrant. First, the upper left quadrant, the upper right quadrant, the lower right quadrant, and the left lower quadrant. On assessing the muscle reflexes bilaterally, normal reflexes. Now we're going to assess the coordination using the finger-nose test. Can you please put your finger on your nose, then on my finger whenever I move it?
Yes.
But please keep your body still.
Okay.
Thank you. Now we move to the other test, which is the rapid alternating movement. Can you please outstretch your arms and do like this?
Yes.
Faster. Thank you. Can you do the other hand? Faster. Thank you. Normal coordination. Now we're going to assess the sensation. First, the fine touch using a piece of cotton. Do you feel this?
Yes.
Now, please, can you do like this? Close your eyes and tell me when you feel it.
Yes. 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 Yes.
Can you open your eyes? Did you feel the same sensation in both sides?
Yes.
Thank you. Now we're going to assess the crude touch using a pin. I'm going to place this pin on your sternal angle. Did you feel it?
Yes.
Now can you do like this?
Yes.
I'm going to place this pin at different sites on your upper limb. Tell me whenever you feel it.
Okay.
Now please close your eyes.
Yes. 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 Yes.
Can you please open your eyes? Did you feel the same sensation in both sides?
Yes.
Thank you. Now we're going to assess the vibration using a tuning fork. Do you feel this?
Yes.
Okay, now can you do like this?
Okay.
Close your eyes. Tell me when the vibration starts and when it stops.
Started. Stopped. Started. Stopped.
I did the distal, so most probably the proximal is intact. Now the vibration is intact. Now we're going to assess the proprioception. Can you do like this?
Yes.
This is up and this is down.
Okay.
Close your eyes and tell me the direction of your finger.
Okay. Down. 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 Up. Up. Down. 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 Up.
You can open your eyes. Proprioception intact. Now I can say that the patient has normal sensation. Now I'm going to percuss along your spine. Tell me if you feel any pain.
Okay.
Now I'm going to apply slight pressure. Tell me if you feel any pain. Did you feel any pain?
No.
Okay. By examining the back, no bed sores, no swelling, no deformity, and no tenderness. Now we're going to assess the Romberg test. The feet should be close to each other. You can close your eyes. Don't worry. I'm going to catch you if you fall.
Okay.
Thank you. Negative Romberg test. I will complete my examination doing the lower limb and the cranial nerve examination. Lastly, I'm going to wash my hands and take my patient.